can you use AI to help navigate your health condition? Here are my tips on how to utilize AI when you're getting absolutely nowhere with your healthcare practitioner. AI stands for artificial intelligence. It's a technology to help humans with tasks that technically they can perform, but it does it faster and more efficiently. This technology involves machines and software that have been designed to process and analyze large amounts of information, helping with decision making. For example, it can run through studies on endometriosis and fertility and summarize the findings for you. Or it can help you better understand an upcoming medical procedure. When I was planning on having surgery privately, my consultant told me that based upon investigative findings, we could go down 3 possible routes. A laparoscopy involving him, the gynaecologist, and a colorectal specialist. Laparoscopy with him, a colorectal specialist, and a hepatobiliary specialist to possibly treat diaphragmatic endometriosis. Or laparoscopy with the 3 surgeons plus VATS. That's video assisted thoracic surgery with the thoracic specialist. Now, my gut told me to go with option number 2, a gynae, colorectal and hepatobiliary specialist. But at this point, I was incredibly overwhelmed with so much information and a lot of emotional turmoil at the thought of having to have this surgery. And to be honest, my family weren't exactly very helpful because, understandably so, they didn't fully understand it themselves and they didn't want to feel like they were making this huge decision for me. So I decided to run everything through ChatGPT. We had some back and forth and it came to the same conclusion that I did, which helped me make the final decision. And it turned out to be the right one. Patients have used AI to help them make sense of their MRI reports. They've used it to better understand their symptoms, and they've even used it for post-op aftercare support because it's been non-existent within the healthcare system. But please note, and this is very important, AI isn't a medical professional. Sure, medical AIs exist, but your ChatGPT, your Gemini, your Grok, they're not specifically trained on medical practice, much less trained in your specific condition. So to clarify, it's no replacement for an actual expert in the field. When using AI to navigate your health, patients must be wary of potential misdiagnosis, data privacy breaches, algorithmic biases, and the lack of human oversight. So you really need to use your initiative. Any information obtained from AI tools should be used as a supplement to professional medical care. And I say that knowing just how incompetent and unhelpful our national healthcare systems can be. AI is a great tool for gathering information and for providing guidance. It can prepare you for having conversations with your doctor, but it's on you to use that information constructively. Don't barge into the doctor's office and dictate to them, saying, ChatGPT said this and therefore you should do that, especially if the doctor is an egomaniac with a godlike complex. You're just going to piss them off. Let AI teach you how to speak NHS in a pragmatic way so that the doctor is more likely to be open to receive the information and hopefully provide you with the care that you need. For example, recently I shared that I had a host of symptoms that I couldn't make sense of but I felt could be linked to my bowel. So I liaised with ChatGPT, which gave me more information and advised that I should speak with my GP. And I did, and my GP took action almost exactly as ChatGPT had described. When I spoke with my GP, I simply laid out my symptoms and I coloured in the parts I hadn't thought of that ChatGPT had informed me on. That would lead to my GP concluding that certain tests would need to be done. So I gently put this all to my doctor, allowing him to provide a solution. I didn't tell him about my chat with AI, and I certainly didn't tell him what he should do because AI said so. This is based on knowing that my GP is pretty old school, he's very experienced, and when led, he will deliver. This is not to say that other GPs aren't more open-minded and open to your own investigative research, but What I'm trying to say here is read the room. If my GP didn't follow up with any kind of investigation, I would have then challenged him citing NICE and NHS guidelines. Because when AI gives you information, it cites where the source is from. Another important thing to note that is key to getting information out of AI, that is the most applicable, the most tailored to you, to your individual case, is to prompt and challenge it. I'll give you 2 examples. With my recent bowel situation that I mentioned earlier, initially ChatGPT was referring to bowel health generically, talking about things like digestive issues resulting from things like medication. Then I prompted it with my bowel endometriosis. I didn't just say, well, what about bowel endo? I stated that I had bowel endometriosis that had been treated with a bowel resection surgery. I also shared what my diet was like and that I wasn't on any medication to rule those things out. After that, I got a whole load of new information tailored to my individual condition about the resection being a possible root cause that quite honestly I wouldn't have even pieced together because of how my recovery's been since my surgery. On another occasion, when an MRI diagnosed me with adenomyosis of the gallbladder, whatever that means, I was clueless, and so were my doctors. My GP literally Googled it in front of me. At this point, I hadn't been diagnosed with diaphragmatic endometriosis, so I thought to myself, could this be the cause of my cyclical upper abdominal symptoms? So I asked ChatGPT, can adenomyosis of the gallbladder be caused by endometriosis? And ChatGPT outright told me no, and so did my doctors. And then I read through what ChatGPT had written, and I spotted that it said that this condition could be caused by inflammation. That's when I thought, hold the phone. Isn't endometriosis connected to systemic inflammation? Did ChatGPT miss this link? So I challenged it with this information, and ChatGPT corrected itself, and it applauded me. Rightly so. All of this is to say, don't just blindly follow what AI tells you. Use your discernment. And if you're ever unsure, ask the community, because 9 times out of 10, we'll know better.